This is the case of post-myocardial infarction (BST). In this image, what you see, you can see this left atrium, left ventricle, and then this right ventricle. This is the location of BSD. So in this case, due to MI, the certain most inferior portion of muscular interventricular septum is damaged. The damage extent is very high and causing BST. In next image, you see the same thing, BSD. This is left atrium, left ventricle, this is right ventricle, then this is BST. In this short axis view, you can see this is anterior wall, this is interventricular septum, akinetic. This portion and this portion is having good motion. Portion that is having good motion, this is inferior wall, this is posterior wall and lateral wall. All these three walls have good inward motion and rest part is akinetic. So this is the case of anterior wall myocardial infarction. This is apical 4-chamber view. In this view you can see mid and apical interventricular septum, apical lateral wall and apex akinetic. This is parasternal long axis view. You can see that this portion, the mid portion and apical portion of anterior septum is akinetic. You can see the BST is located near the apex. BST caused by myocardial infarction is usually located near the apex or in anterior part. You can see here the turbulence follows both upwards and downwards, above and below the line, signifying the turbulence. This is the size of BSD, that is 6 millimeter. You can see the BSD. Follow, this is left ventricle and this is BST, and this is the blue flow is in the right ventricle, this is in the left ventricle. Image is parasternal long axis in RV outlet view. Parasternal long axis, if you just angle towards left side, that is RV outlet view, that means right ventricle and pulmonary artery view. In that view, what you see, flow from left ventricle to right ventricle, red flow within left ventricle and blue flow within right ventricle. IVC is dilated in this case. You can see this is a long axis of IVC. In sagittal plane of abdomen, you see this IVC. This is 4-chamber view or 5-chamber view in subcostal window. Again you see the BSD. This BSD is quite dangerous. Most of the patients having significant amount of chest pain and shortness of breath. In this case, surgeries is indicated to close the BST. Finally, this is the case of anterior wall MI with BST near the apex. All chambers are prominent. IVC dilated, size 6 mm. At turbulence you can see across the BST. Turbulence is also seen within the right ventricle. You can see the mid and apical, usually apical portion or the mid portion of anteroseptum is akinetic. Apical 4-chamber view, you can see the apex and mid and apical portion of IVS akinetic. Parasternal short axis view at the level of papillary muscle, you can see the akinetic segment. See the BST, see the BST, see the BST. Thank you.